It's time for health, your super informative turmeric latte charged ginseng powered antioxidant rich natural health podcast with a slice of lemon. And I'm your host, Greg Newson, naturopath, herbalist, nutritionist, and we're here today for the Vitality and Wellness Centre. Sponsored by NatraVital Health Supplements, 100% pure active ingredients, no binders, fillers or additives. Experience the difference today. G'day everybody and welcome to Time for Health. In today's episode we're going to discuss reflux, commonly known as heartburn, acid stomach, sour stomach, GERD or GORD. Now what GORD or GERD are is gastroesophageal reflux disorder. And the only reason why I can see that one is GERD and one is GORD is that in America, esophageal is spelt with an E, begins with an E, and in Australia, New Zealand and other UK countries, esophageal is spelt with an O. First word is an O, just to confuse everybody. Now, the symptoms between reflux, GERD, GORD and heartburn, they're pretty much all the same. People generally suffer from that burning sensation in the centre of the chest. They can feel like there's a weight on the chest, there's a pressure. They can get that sour, bitter taste in the back of the throat, or that stuck feeling like food stuck in the back of the throat. The difference between reflux, heartburn and GORD is that reflux, generally, those symptoms occur once a week or less, whereas GERD and GORD, I'm going to get sick and tired of saying that, their symptoms generally occur twice a week or more. Now, to cut out this GERD and GORD fiasco, I'm just going to call everything reflux. So reflux, if you suffer from GERD, if you suffer from GORD, depending which side of the world you're on, if you suffer from heartburn, bit of acid reflux, sour stomach, it's all just going to come under the banner reflux. Now, obviously, reflux can be quite painful and distressing for a lot of people, and if left unchecked, it can lead to damage to the cells that line the esophagus, which is, it becomes a condition called Barrett's syndrome, which means that those cells are pre-carcinogenic, which then, if that's not treated, they will then, very good chance, actually very high chance, that they will lead to esophageal cancer. Okay, so that's not a good thing. So what can cause reflux? Now, for some people, this can vary for a lot of people, but for some people, it can be triggered by food. Some people have some spicy food, some fatty food, some fried food, alcohol, gluten, chocolate, caffeine. They can all cause a flare-up of reflux, and I'll explain why in a little later. So can having a big meal. So you eat too much, and that can overcrowd the stomach, meaning there's not enough room left in the stomach. I know the stomach can stretch, but it's got everything around it. It can't stretch that far, and the food can then come back up. If you're overweight, that excessive fat can put pressure on the stomach and force the foods upward, back up through the esophagus. And smoking is also a known cause of reflux. That's great, but what really happens in the body? To understand reflux, we need to understand the digestive process. So let's look at that. When we chew our food, our teeth start to break down the foods. We eat a piece of steak, we eat some nuts and seeds, we eat some bread, some fruits and vegetables. The teeth break that food down. Now, we also produce saliva, which has multiple effects. Saliva contains an enzyme that helps break down the carbohydrates, amylase. It also lubricates the food so it can travel down the esophagus. It also then tells the stomach, hey, stomach, got some food coming. You need to start creating the digestive juices, in particular stomach acid, to break this food down. So let's think of it this way. You've got an old building that needs to be wrecked, and you've got one of those cranes with a big wrecking ball on it, and that wrecking ball comes along and hits that wall and breaks that solid wall down to big chunks of brick and debris and rock. That's what the stomach acid does to the food. From there, those big chunks of brick pass into the small intestine, where the digestive enzymes that are produced by the pancreas then break that food, or that, no, it's not, well, yes, it is food, but in this case it's a rock, breaks that rock or brick down to grains of sand. That grains of sand are then absorbed through the villi, which are finger-like projections that line the small intestine, or the small intestines, and then that is then absorbed into the bloodstream and then sent to the liver, and the liver then shunts it off to where it needs to go in the body. So as the food passes down from the mouth into the stomach, it goes through the esophagus. And in the esophagus, where it joins the stomach, is a valve called the esophageal valve, which is basically a group of muscles that allow food to pass through and generally don't allow food to pass back up. So think of it like this, like a trapdoor. A trapdoor spider, a spider sitting under the ground, it's got its little door there, an insect walks past and the trapdoor opens and then the spider grabs the insect and devours it. Well, this trapdoor is going in the other direction. So when the food passes down through the esophagus, it hits that trapdoor opens, swings downwards, food passes into the stomach, trapdoor closes, nothing can pass back up generally. If that sphincter valve is leaky, that then will allow acid to pass back up through and then burn in the esophagus. And it's worse when you're laying down at night, so you're in a lying position because that valve is leaky, and then all night stuff can just run up the esophagus, and it can cause the pain, it can cause the burning. You might not even get any of that. You might just get a metallic sour taste in your mouth in the morning, or you may get constant coughing, or even a postnasal type drip, so you're getting all this mucus coming down the back of the throat. And the mucus is there to protect the cells from damage. That's where the body produces mucus. Mucus is there to protect. So in your stomach, you have all this acid. Well, between the lining of the stomach and the acid, there's this thick layer of mucus. If that acid burns down, or that mucus wears away, that acid will then burn down and cause an ulcer, right? Which is going to cause a lot of pain. So problem number one, or a major cause of reflux, is that leaky valve, which we'll explain how we can rectify that or fix that a little later on. But most people think that reflux is caused by too much acid. Well, I'm here to tell you that it's not. It's the other way around. It's caused by too little acid. So let me explain. Now, there's some people that they do produce too much acid. So in iridology, those people will have, you've got the pupil in your eye, and then around your eye, you've got this, most of us will have a little brown ring, which is our intestines. If yours is white, you must be producing too much stomach acid. All right, but you can check. There's a lot of images of that on the web if you want to check that out. But I digress, as I usually do. So where was I? Yeah, too little stomach acid. So think of it this way. Grab a piece of meat or chicken, put it in a Ziploc bag, close the Ziploc bag, throw that bag out in the sun, come back and have a look at it in 3, 4, 5, 6 hours' time. You will find that the bag will have expanded. The gases in the bag will have expanded. So when you open that bag, besides having a nice ripe smell to it, all the gases will escape and the pressure will be taken off the bag. If your body does not produce enough stomach acid and you gulp your food and you don't chew it properly, that food sits in the stomach. There's not enough stomach acid to break it down. It starts to ferment. Once it ferments, you produce gas. So people that do a lot of burping, you're going to have reflux later on in life because you're not producing enough gas. And I'm not talking about if you just drink a lot of soft drink or beer or fizzy drinks. I'm talking about you just eat food and then you're burping. That tells me you don't have enough stomach acid to help break the food down. And you might be able to get away with it now, but fast forward 10, 15, 20 years, you may not, and you may then have reflux or GERD, whatever, heartburn. So when that food ferments, that produces gas that goes up or it produces gas that goes down. So you get a lot of flatulence as well. But if it's pushing the gas upwards and that trapdoor, that sphincter valve is opening, it's going to cause that pain, it's going to cause that burning, it's going to cause that full, heavy feeling because you're not breaking the food down effectively. Now, when I say not enough stomach acid, yes, so you've got all the cells in the stomach, the parotid cells and etc. that help make a whole heap of different acids and enzymes, and the main one is hydrochloric acid. Now, hydrochloric acid, as we know, has a very low pH. It's what we put into, say, a concrete pool to balance the alkalinity. It's also what you can use to clean tiles and concrete and that sort of stuff. And once you put it on things, it bubbles up, froths up. You land it on your skin, it burns like hell. Well, it's the same scenario in your stomach. You need to have a pH in your stomach that is quite low, and it's generally around 1.5. And that high acid, that high concentration of acid, it starts to burn or break that food down. It breaks the bonds that join the food together. If your pH is higher than that, say 2, 2.5, the pH or the acidity of that acid is not strong enough to break the foods down effectively. And then those foods start to ferment. Once they ferment, they start to produce gases. Those gases then cause an expansion or pressure on the sphincter valve, and the gas either comes back up, as I've just mentioned, or it goes down. So you get burping, reflux, you can take some acid with it, or you go down the back end and you get a lot of, playing a lot of tunes on your trumpet, so to speak. So how do we fix that? We will get to that a little later on. I'm giving you a few, reasons to keep on listening. So it's not all doom and gloom. There is a lot of things that can be done to reflux, and reflux is not a lifelong condition. We can quickly rebalance the body and have dramatic improvements in reflux without the need of pharmaceutical medications in a very short period of time. Depending on the severity, some people can be reflux-free within 3 months, other people it's 6 months, other people it's 9 months. It just depends on the severity. But I'm getting ahead of myself here. Just have to wait to the end. Besides the obvious signs of reflux, which is the pain, the burning, the pressure, and then, unfortunately, the esophageal cancer, there is quite a few other side effects that we don't even think about because we're not physically experiencing them. But if we're not breaking our food down properly, and that's what happens in reflux, we're not breaking the food down properly, then other parts of our body suffer. So we basically start to be suffering from malabsorption, because we can imagine a big chunk of rock or wall or food, a bit of steak, lamb, chicken, that goes into the stomach but doesn't get broken down properly. Then you've got all of these workers, once it gets into the small intestines, trying really hard as the food's passing through to break down whatever it is effectively so it can then be absorbed into the body. Well, a lot of that passes through. You'll get gas, you'll get smelly poo, you'll get constipation, you'll get diarrhea, you'll get a lot of digestive symptoms, mainly because the food is fermenting in the small intestine and the large intestine, the colon, because it's not broken down properly, or as it should be, and it's foreign, and so the bacteria, the good and the bad, will attack it. They all produce gases. They've got stuff goes in, stuff comes out. Well, if the wrong stuff goes in, the wrong stuff goes out, and that can cause gas, which then can cause the bloating, cause the abdominal pain, the diarrhea, the body's trying to shoot the stuff out, or it binds you up. So, stomach acid and stomach function, often forgotten about, but very, very important for long-term health. It's the beginning of the process to absorb all the nutrients out of your food. Those nutrients feeds every single cell in your body. So if we don't treat reflux, every single cell in your body will suffer because you're suffering from malabsorption. So a lot of that food is then going to pass through unbroken down and ferment in the colon, as I've just mentioned. But then your eyeball suffers because it doesn't get enough lutein or xylanthin or vitamin A. Your brain suffers because it doesn't get enough essential fatty acids. And then the liver can suffer because it doesn't get enough Bs or other nutrients to improve bile flow and detoxification. And trust me, that list can go on. Then we got the immune system, and then we got the kidneys, nervous system, cardiovascular system, a skeletal system, the muscular system. So it's very important for our long-term health to look after our digestive system full stop. And in this case, we're talking about the stomach and reflux. And most people think, stomach, I've just got to do a colon cleanse and that'll fix everything up. My digestive system will be fine. Well, the colon's one organ, the small intestine's another organ, stomach's another organ, teeth are another organ, your liver, your gallbladder, your pancreas, they're all involved in the digestive process. So what better way to give them the best start that they can have is firstly is feed them well, and secondly, get the whole digestive system functioning. And the whole digestive system begins with the teeth and stomach. If you suffer reflux, everything downstream, not going too well. Now, people that suffer from reflux and that burning pain, Most of them, if not 99.99% of them, will have gone to their local GP and explained that to them, and the GP would have then put them on reflux medication. Now, there's two types of reflux medication. There is the PPIs, which is the proton pump inhibitors, and they form a class of drug that generally ends in parazole. So omeprazole, I can't pronounce them. They're just terrible names. But there's things like Nexium, Somac, Pariat. They're common names of those medication. You can get over-the-counter pharmaceutical medication that can help reduce the symptoms of reflux, and they're generally called H2 blockers, such as Xanax or Pepside, or you can get antacids such as Quickies or Gaviscon that may help also. Now, you may think that's great. I've got some sort of drug that's going to help lower my stomach acid, and it might sound good in theory, but what is actually happening to your body is not so good. So the PPIs, the proton pump inhibitors, which is Nexium, Somac, etc., and the Xanax, which is your H2 blocker, and your antacids, they all lower stomach acid, right? So, oh yeah, that's good. I feel so good. Yeah, I haven't got that burning now. But when you lower stomach acid, and it's not actually that you're lowering stomach acid, you're inhibiting your body from producing adequate amounts of stomach acid, or you're diluting the stomach acid. So, for example, sodium bicarbonate can help dilute stomach acid because it's very alkaline. But then that stops your body from absorbing nutrients. Hence, a little bit of a digression here, why if anyone takes sodium bicarb, you should take it at least an hour away from food. So your stomach can then start to produce stomach acid and break the food down effectively. Now, the proton pump inhibitors, most people, what you don't know is that you're only supposed to take them for 2 years or less, no longer. I've had patients come to me and they're in their 50s and their 60s and they've been on this type of medication since they were 18. And I just shake my head. Now, let me explain why. For your body to manufacture stomach acid, there's a couple of key nutrients that are needed. Zinc, paramount, vitamin B1, B6, B3, and the amino acid histidine. Now, I'm going to do a little bit of chemistry here. You know, I'm a bit rusty with it as well. But let's take, for example, magnesium. Magnesium, when you get it in food, has 4 electrons bound to it, which basically your body can't break down. Your body can't use it. But once it goes into the stomach acid, 2 of those electrons are cleaved off, and then it becomes magnesium or calcium or whatever with 2 electrons. That can be easily absorbed by your body. Now, lowering your stomach acid using PPIs has been shown to inhibit the absorption of zinc, magnesium, iron, calcium, vitamin D, all of your Bs, C, folate, which is also a B vitamin. Now, they're pretty essential nutrients that your body needs. Now, they say you should not be on PPIs for any longer than 2 years because it dramatically increases your risk of cancer. Now, that is scientific studies. You can Google it or whatever browser you use and you'll find the studies. The 3 big nutrients for the immune system, zinc, commander-in-chief, vitamin C and vitamin D are both 2 ICs. Iron actually tells your cells if they're mutating to die. It will flick a switch and cause apoptosis, which is cell death. So all very, very important in preventing cancer. So it's a catch-22 with the PPI medication. As you lower stomach acid, as they do their job, they inhibit the absorption of zinc, B1, B3, B6, and the essential amino acid histidine from food, which means that your body can't, if you can't absorb it, you can't make more stomach acid. You can't make more stomach acid, you're going to have low stomach acid, food's going to ferment. It just goes around and around and around. This is one of the reasons why I dropped the H in pharmaceutical and call medications pharmaceutical. It just, for a short-term fix, yeah, okay. And if you have a life-threatening situation, don't get me wrong, I'm all for it. But for a simple thing as reflux or heartburn, fixing the body is paramount to your long-term health and longevity. You know, it just frustrates me. And that's not the patient's fault, you know, because they, no offense, they're no wiser. It's the doctors, but then again, it's not the doctor's fault because they've been indoctrinated by the pharmaceutical companies on how to prescribe. People have lost the art of treating the human body, unfortunately, and reflux is just a sign that your body, your stomach is in distress. It's inflamed. It's not happy. So we need to regenerate and repair it. And guess what? It's simple. It's not a difficult thing to do. I've had many patients over the years that do suffer from reflux and heartburn and have had a lot of success in getting them better. And I'm not trying to be egotistical. It's just the way it is. I remember one patient, he was in his 50s and mid-50s, and he had been on medication since he was 18 or 17, and that proton pump inhibitor medication since he was that age, and he was on quite a lot, 80 milligrams from memory a day because of his reflux, and he had been to hospital twice with massive chest pains, which they all thought was a heart attack, but it showed nothing. But his stomach was so inflamed. His stomach was not happy. So all we had to do is reduce the stomach inflammation and nurture and heal the stomach. And he's now no longer on those medications. They're gone. It took him might have been about 9 months to completely come off them. But he did that, and it was just a gradual, gentle way of doing it. We just regenerate the body and slowly reduce the dosages. Because if your body hasn't been able to produce stomach acid or work effectively for a period of time, and you've taken a pharmaceutical medication, your body becomes lazy. It just goes, well, I don't have to get out of bed today. I'm just going to stay here. Estrogen? No, I don't need to produce any of that. I'll just, stay in bed. Or stomach acid? No, don't need that either. So we need to, help kick the body back into working properly and effectively. Now, I know you're most probably thinking, yeah, that's good. What can I do to help? I'll give you some herbs and nutrients that are very beneficial to regenerate and heal the stomach, and then I'll tell you what I do in clinic. Before looking at nutrients to effectively treat reflux, we need to look at foods to avoid and why for some people they trigger them. So high fatty foods, so like your French fries, your deep fried fish and chips and bacon and fats and any fatty type of greasy sort of food, they actually cause the esophageal sphincter valve to relax, which then can allow acid to flow back up to the esophagus, and they also delay the emptying of the stomach. Where foods like tomatoes and citrus type foods can worsen reflux because they're high acidic type foods, but they also cause the sphincter valve to relax as well. A food that people aren't going to want to hear about is chocolate. It contains methylanthine, which is a chemical in the chocolate, and it causes the esophageal sphincter muscles to relax and allows the food to pass back up. Obviously, the spicy foods and the garlics and the onions, they can also trigger heartburn by aggravating the symptoms. Alcohol has a double whammy effect. It stimulates the production of stomach acid, and it also relaxes the esophageal sphincter. Gluten and wheat type products, white floury products, they can also trigger reflux because of the gluten, because they create inflammation within the stomach, because a person can be intolerant to them or allergic to them. They also can irritate the sphincter, which causes it to open, and they can be combined with fatty oils to make it a fatty type food. So you know what your trigger is, or your potential triggers are. Best to avoid them. To help close the sphincter valve, there's one great herb, and I generally tell people if you suffer from reflux, make sure you're drinking this herb every single day. You're thinking, yeah, come on, mate, tell me what the tea is. It's simple. It's chamomile. It's so simple. It's the most popular herbal beverage in the world. It's extremely effective in alleviating the reflux burning pain that you get, but it also goes further than that. It helps to strengthen the sphincter and regenerate the sphincter valve. In conjunction with chamomile, golden seal is a really beneficial herb to help regenerate the sphincter valve and also soothe and calm the mucous membranes, which is any membrane that's inside the body, the mouth, the throat, the esophagus, the stomach, the intestines. So the combination of those two herbs works very, very well in improving reflux symptoms. If we look at the stomach, there's a great herb called meadowsweet. It actually brings back balance to the stomach. It helps the stomach to produce more stomach acid, Or if you've got over acid, it helps to lower the stomach acid. It's a herb specifically for the stomach. Now, if you've got a lot of inflammation in your stomach and you'll simply know that, where your stomach is, around where the breastbone is, in the middle of your chest, just have a bit of a lie down and press down on that. And if it's sore, your stomach is inflamed. That's a good way of knowing your stomach's inflamed. Or if you've got a lot of pain in that area, that's a good way of knowing your stomach's inflamed. Well, we've got to reduce inflammation. So turmeric, ginger, chamomile's also an anti-inflammatory, so is golden seal. Nettle, or nettle leaf, not necessarily nettle root, but nettle leaf. Green tea, cat's claw, they're all great anti-inflammatory herbs, and they will help reduce the inflammatory process within the stomach, and they'll help soothe it. Now, if your stomach is inflamed, I generally will give people a glutamine, slippery elm type powder to help coat and soothe that stomach even further. With any treatment of any condition, we don't stop the medication. We need to regenerate and repair, and then, if it's okay, we then gradually reduce the medication. Right? So the medication is always there to help prevent any of the discomfort that's associated with it, but as the body heals and regenerates itself, the need for that medication dramatically reduces. And a lot of people can become heartburn, GORD-free, pain-free, and pharmaceutical medication-free as well. In the clinic, treating someone that suffers from reflux or heartburn, I will give them a tonic called Stomach Support, which has a combination of chamomile, golden seal, marshmallow, meadowsweet to help regenerate the stomach, to help reduce the inflammation within the stomach, but also to balance out the stomach acid production and heal and strengthen the sphincter valve. Now, if they're in a lot of pain, I'll use inflammatory support as well. That will help reduce the stomach inflammation, and I will also use another product by Natravital called Intestinal Repair, and that has a combination of glutamine, slippery elm, nopal cactus, marshmallow, aloe vera, and they all help soothe and regenerate the lining of the stomach and the intestines as well. If you're interested, there is some links in the text below to give you some more information on those products. To make it a bit easier for everyone, we've put together a treatment protocol, if you want to call it that, for someone that's suffering from reflux or GORD and can't afford a consultation to go see a healthcare practitioner. Just this is based on what success we've had in the clinic over the years. So, it may not work for you, but generally it seems to work quite well. But, I can't promise anything. I'm not that good. The treatment protocol is free, so just click on the link below and you'll be able to download it. So hopefully that gives you a greater understanding of reflux and what causes it and what can be done naturally to help improve it and what you can do to get off the pharmaceutical merry-go-round. Check out the links below for more information. And now the legal side of this. Any information that I've provided is purely educational and is not meant to diagnose, treat or cure. We recommend consulting with your healthcare professional before undergoing any treatment. Stay safe, and until next time, live life and laugh loud.